Hi and Assalamualaikum everyone. My name is Nur Elisa Najwa binti Zulkifli. Today I'm going to present about iris atrophy, one of eye disease that could affect us as a human. So, what is iris atrophy? Iris atrophy is a condition where iris is damaged due to degeneration or tissue loss and producing holes in its region. Iris atrophy is a rare disorder among humans and it commonly occurs among animals like cats and dogs. Iris atrophy usually affects in unilateral condition, which is only one side of our eyes will be affected instead of both sides. Iris atrophy has several types depends on how the disease is happened, which is primary, secondary, and senile iris atrophy. Primary iris atrophy occurs when the disease is happened without any underlying conditions like iridoschisis and ICE syndrome. Secondary iris atrophy occurs when the disease is happened due to several factors like surgery or trauma, while senile iris atrophy occurs due to aging. There are several factors that can cause a person for having this disease. One of the factors is aging. Aging is a natural process in our life and it is categorized as senile iris atrophy. The second one is inflammatory. Inflammatory on iris could occur due to infection by bacteria or virus. If a person is having any other eye disease like glaucoma or uveitis, in some cases it will lead the person for having iris atrophy too. Instead of eye disease, a person who has diabetes also has a potential for having this disease. However, iris atrophy also can happen since the person is born. Other than that, if a person is having any surgery on their eyes, it also can lead the person for having iris atrophy. So how can iris atrophy occurs to us? Iris atrophy occurs when the layer of the iris is affected, especially the stroma. So iris atrophy occurs when the stroma layer is thinning and weakening, or maybe in some cases, the stroma will be replaced by fibrous tissue. As we know, stroma layer in our iris have a lot of important things for us, like blood vessels, collagens, pigmented cells, non-pigmented cells, and also muscles to dilate and constrict our pupil. So let's imagine, if the stroma is thinning, the important things in the stroma region also will be less functioning, right? For example, if the collagen fibers is decreased, the iris will be in irregular shapes and the holes is produced. Other than that, the muscles in our stroma regions also can be less functioning and difficult to dilate and constrict our pupil, and it will affect our vision. And if the pigmented cell is decreased, a person who has the iris will see his iris becomes brighter. So, what are the symptoms to diagnose people who has iris atrophy? One of the symptoms is iris color changes. A person with iris atrophy will see his iris becomes brighter or the iris in each side is different. And this is due to the loss of pigmented cell. Other than that, a person with iris atrophy will see there's a patchy areas in his iris. The patchy areas looks like holes and we can see it as two pupils. The next one, a person with iris atrophy will have glare sensitivity due to the muscle is difficult to control the amount of light that enters the eye. Due to the less functioning of muscle also, the pupil is dilated and constrict slower than the normal behavior. Last but not least, the person will have visual disturbance due to the amount of light is not in the control. For example, the visual acuity of the person is decreased. Also, the vision is started to blur. So these are some references I use regarding this disease. Have a look. The last one, I appreciate so much for your ears and eyes to listen and watch my video. And please feel free if you have any question to ask me regarding this disease. Thank you and tata. Bye guys.